Hello, this is Anne DeGheest, and it's October 23rd. And this is a special review of long COVID. This is really important there because the true risk of being infected with COVID is not a fatality rate, which we know is around 1%, but can you be at risk of 10 to 30% complication there? So if you haven't seen the update I did yesterday there, there's a lot of good news on the boosters and the vaccine effectiveness. So you really want to see that YouTube video. I'm going to be focusing on this video on what's called post-acute COVID syndromes. It's estimated to be around a 33% risk, regardless of age or how severe your COVID infection was. So it's quite significant. That is the real risk of this disease. I'm going to spend some time with the real data and picture on showing how it affects all your body organ. And it's pretty much a nervous system injury from head to toe. The leading symptoms is chronic fatigue and brain fog, which could create you a major disability. Half those patients can no longer go back to work, and it could be for a very long period of time. I'm going to do a deep dive on how it affects your brains, your heart, and your lungs. So this is an important video. I need your help to spread the word. YouTube has changed the algorithms there. So if you appreciate this content, please help me spread the word by subscribing and posting to your network. We have to do it the old fashioned way, which is the network effect. So I appreciate your help if you like this content. So what are we talking about? Really, we've been focusing on the mortality rate, and big argument is at 0.5, 1% and all of that. It is going to be totally irrelevant as we look at this disease 5 to 10 years from now. What we're going to be talking about is the tip of the iceberg. That's what we're talking about, which is people are hospitalized in the death. The big problem is people are mild to moderate or worse, asymptomatic. And suddenly 3 months after they got infected, they start having these really very strange symptoms, including 2 people I know who end up having massive heart attacks. So let's take a deep dive to see what is going on here. This is popularly known as long COVID. The legal term now is called post-acute COVID symptoms, called PASC. And the data is a bit all over the places about what's the incidence rates. The CDC estimates around a third. And I'm going to show you some data. It's between 10 to 50% of all infected people, and that could be as many as 10 million Americans, are now dealing with this problem there. So these are not people who end up hospitalized and on a ventilator. This is everybody who got infected. The data is very clear-cut that at 7 months, this still has debilitating symptoms. And it's, again, as I emphasized, that it's regardless of age and severity. So I'm going to show you a lot of the data that are pretty much stunning. Data just came out that 73% of post-COVID survivors have at least one persistent symptom 7 months later. So it is affecting pretty much everybody that's infected there. The bad news is that we don't really know how to help this population. You're going to see it's affecting multi-specialties, and healthcare is not really good at coordinated care between multiple specialties. Traditional treatment, which is just go exercise and shake it off, is exactly the opposite. You should not tell those patients to do it. I'll spend some time on that because it will aggravate and hurt them. And it has like between 98 to 200 different symptoms. And so at times it has been kind of a whack-a-mole for people to try to diagnose this. So it requires multi-specialists to coordinate this. So people are now emerging with long COVID centers and major teaching hospitals across the country there. The primary care providers are very frustrated and are well educated. There's no obvious test to basically diagnose those patients there. And it's perceived that it's the new disability class that's being created there, with up to 50% of those patients are not able to go back to work after 6 months, and it could be for years afterwards. So what are we talking about? So during the infection, you have the viral load, and this is that period there where you have the symptom of onset kind of peaks at 10 days, and then the virus kind of leaves your body there. And then we know we have this inflammatory, the cytokine response, which creates all the side effects that people may end up in the hospital there. We're not talking about any of that. What we're talking about somehow, and we'll talk a bit more about it, when you get the virus, it damages your organ, and it creates a cascade of damage across your body there that creates persistent symptoms, okay? The infection is over. It's what happens because of the infection that creates this long COVID. And so the World Health Organization has just come out with what they call a case definition. And that just came out a few weeks ago. And in order to be defined, you need to have had a PCR test. And that's the problem right there, because half those patients in this organized support group didn't have access to PCR at the time when we had problem in lab tests there. They have typically defined as having symptoms 3 months after they had the infections. And the symptom lasts at least 2 months after that, okay? The typical symptoms are brain fog, can think straight, chest pressure, pain, depression, fatigue, fever, heart palpitation, and shortness of breath. I'll spend more time on that. And we cannot explain the symptoms with the traditional diagnostics tools. So, sorry, I'm going backwards. The NIH finally launched a program. They call this the Recover Study there. And this could be something you may be interested in. You may enroll at recovercoded.org. It's only for new patients, not patients who ended up being infected last year there. So they're only enrolling new patients there. And that's a bit of a problem there because a lot of people are vaccinated. And so the enrollment rate is going to be affected by that because you have half the risk of getting long COVID if you're vaccinated. And so they believe there's 39 million people there that they're basically pulling that from. And they have 100 researchers in a lot of 200 clinical sites that are going to be working on this. It's a massive effort led by the NIH. Whoops. CDC also is finally moving in, and they had a whole review, and I'll share some of the data there that was shared to the primary care providers there. So these are all the data from the NIH and CDC. This is as legit as the data is. So what are we talking about? Most of the common symptoms is intense fatigue. I'm talking you go up and down the flight of stairs and you sleep for 2 hours afterwards because you're so exhausted. You have what's called post-exercise malaise. That is very important to understand. It's the key definition of this disease. You do some very mild exercise and you're absolutely crashed for a couple of days afterwards to recover there. You have chest pain when you're breathing. It literally hurts. You have what's called cognitive problems, which is similar to traumatic brain injury or concussions there. You have shortness of breath. You still have lost your taste and smell and it hasn't come back. And you have what's called POTS. POTS means you're sitting, your heart rate and your blood pressure are stable, and then you go up, you stand up, and suddenly your heart rate and blood pressure can control themselves. And that is a typical sign of, you have a damage to the heart. People have problems sleeping, and as a result of all those problems, they have a lot of anxiety and psychosis. It turns out that Ebola and Zika have similar problems. It is kind of typical of these really nasty post-viral infections there, where it somehow creates a cascade of damage across the body there. And pretty much the autonomic nervous system, which is what manages your heart rate, your blood pressure, your breathing, all of that is no longer working effectively there. And so let's look at some of the data there. Data came out from JAMA. That was a massive review of 57 study of around 250,000 survivors. And what's pretty stunning is that after 6 months, 54% of people had been infected. And that includes people who were mild and asymptomatic. So I just want to make it clear, these are not people who end up on the ventilator. 54% of these people, they had some type of problem 6 months later. And look at the data that have been published there. You can see it's pretty much data from all over the world. Some of them are a longer period of time, and like the US is probably one of the longest one. But the frequency of this symptoms is stunning. I mean, 75% is that line there, 50% is this line. Pretty much everybody is having a hard time recovering from a COVID infection. So the reason why you want to be vaccinated is not to avoid fatality there because you're young and you're indestructible, but because you have this really high risk of having long-term problems there. And I'm talking mental health disorders, pulmonary abnormalities. I'm going to do a deep dive. I'm going to show you what's happening inside your body there. So another data just came out from the CDC this time and from the US, where they look at 81 million patients there. So again, very large data sets. We're finally getting big numbers there. And what they show is that 46% of these long COVID patients, the people, children and young adults, had these symptoms there. It's not the elderly, but everybody regardless of age group. On the average, the estimate is around 33% at 3 to 6 months after they got the infection there. And a lot of people have pain. And so, oops. So I'm going to, people are hospitalized, so this is the red line, have a higher chance of having cognitive problems and fatigue. So there's no doubt if you're hospitalized, especially if you're on a ventilator, you have a higher risk. But again, I want to emphasize it's across the board. Let's take a look at another way of looking at this. If you look at the whole population they looked at, around 20%, a bit 18% of cognitive impairments there, memory problems, problem concentrating executive function. They had problem concentrating there, over 25%. These are significant number there at 6 months. If you look at fatigue and muscle weakness there, this is close to 40%. These are absolutely incredible numbers. Look at the range of some of those people there. Chest imaging that are abnormal. So when you do an X-ray and a CT scanner, it is abnormal. This is like stunning. This is 60% that they can see fibrosis or some damage inside the lungs. And functional impairment there is the inability of doing traditional functions there is over 40%. So these are significant number. Cardiac disorders, the digestive disorders, it's everywhere. Your whole body gets wrecked. So if you were mild asymptomatics, they showed in this data there that was reported by the CDC that 35 to 54% of patients who had mild symptoms and persistent symptoms after 2 to 4 months. I just repeat that. 35 to 54% of patients were mild, therefore they stay at home and therefore they were fine as like a bad flu, had problem 2 to 4 months later there. And this is the other thing that was a big surprise. A lot of people basically thought they recovered, and then suddenly 3 months later, they start having symptoms. And when they got to a specialist there, it was tied to the fact that they had the COVID infection there. So some of these people there, the symptoms kind of emerged a few months later. So if we look at male versus female, there's no doubt that female are a little bit worse off than the male population there in some of the symptoms there. And the older population has more cognitive problems there. The brain is much more fragile just because we're normally aging there. So you really want, if you're the age of 45, to protect your brain because all of these people there have a 2x risk of having cognitive problems. The good news, if you get vaccinated, you decrease the odds and the risk of getting long COVID by 50%. This is a data that came out of the UK on 1.2 million people with vaccinated, and they show that the breakthrough rate of infection was 0.5%, and roughly half of that were people who end up having long COVID there. So you do get protected if you get vaccinated. If you are kids, the risk also is lower, and this is a study done in the UK by the Lancet, looking at children at different age group there, but it was pretty clear that the 12 to 17-year-old, which is closer to being an adult, were at a higher risk than the younger children there. The good news, because they were young, 90% of them recover after 56 days. So that's kind of the good news for children. I want to emphasize that this long COVID affects all your key organs. It affects everything neurological, which is all your peripheral neuropathy, which is your nerve, all for your body there, as well was called the autonomic nervous system, which was what in your brain is controlling the way you breathe and the way you do things without you thinking about it. Therefore, you sleep, and pretty much your autonomous nervous system, the way your heart rate, your blood pressure is being controlled, is being affected there. I'm going to spend some time on some of the other ones, so let me kind of move around. These symptoms are interconnected. They have discovered that there's this cluster that if you have that symptom, you end up with these other 3 symptoms. So they're all related. And then that thing is progressing over time. And so that what's really the big problem there is not pain, it is the abnormal breathing, the chest pain, the fatigue, the depression, all of them are interconnected. So it's not that you get one. If you get one, you have a high probability of getting the other ones. This is one of the best studies I've seen, and this was done on patients from 56 countries there. It was at 7 months, and they were basically able to monitor the symptoms month to month. And you can see that we had different categories there. These are the severity of the score, and some recovered very quickly there, and some did not. So let's take a look at the one that did not. And they found there were 3 clusters. One cluster slowly improved over time. This is time, and this is a probability of having some symptoms. Some basically did not improve, and this is the one we don't like to see, is that they were fine and then they got worse. And if you look at the one that got worse, it's all the neurological. They have bladder control, they have menstruation problems there, they have speech problem, they have memory, they have the brain fog. And this is what we don't want to see, is that somehow the damage gets worse over time. And then this is more, the breathing difficulties and all of that. So it's really important that we understand the mechanism of action of what's happening to the body. And it's perceived that this is worse side effects than cancer disability. And we all know that cancer is a horrible disease there. And so I really want to emphasize here, I'm not trying to scare you. I just want to educate you that the real risk with COVID is not the fatality rate, but the risk of a long COVID. The number one problem is chronic fatigue, and that's roughly 24% of patients post-infections have this extensive fatigue where they cannot have a normal life. As a result of that, a group of 32 leading COVID clinics are now starting to put together some guidelines and consensus on how we diagnose and hopefully try to help these patients rehab themselves. And I say rehab there because 10% of these patients are something we can really see for the heart or for the lungs. But 90% of them, when they do all this testing, turn out that they are normal because we cannot really measure the nervous system effectively. We cannot really image that. So we're now coming up with these rehab programs to help those patients there. So for example, if you have fatigue, depending how bad it is, you have, people in the worst case, they're mostly confined in their home and in their bed, and they're really very, they can really not have a normal life there. And so they have all this program to slowly rehab there. And this program could be 6 to 12 months long. I'm not talking PT after you've had this ankle sprain. So what could be the cause of this? We don't really know, to be fair. There's several beliefs. One is that there's clearly a damage to the autonomic nervous system. That's called dysautonomia. And that's what's control your blood vessels constriction, your control of your heart, and for a lot of these people have abnormal heart rate and arrhythmias, and drastic change in blood pressure. They have also pains, pain on all their body aches. There's also another belief that there could be some virus who's finding some spaces in some glands that are protect from the immune system there. And we've seen that with some of the other viruses in the past that they can hide. And the reason why there's a suspicion about that, because when these patients have these symptoms and they give them a vaccine, a third of those patients there go back to normal in a matter of a very short period of time there. So there's a perception there may still be this virus reservoir we're basically hiding in the body that just need to be flushed out. And then there's a perceive that a lot of people may have had a risk for autoimmune disorders, and it's just the immune system drops so much that these disorders just kick in and no longer can be controlled. And so we also know that there has been coagulation problems when you have the active infections there, and that may lead to blood clots and a whole bunch of other damages that creates a cascade in the brain. And we know a lot of these patients there still have a problem with the sense of smell and taste that doesn't come back. So let's take a look at some of those. Data just came out that when you get this cytokine storm, you may create what's called autoimmune antibodies. And they believe these are the ones that can create this long-term damage that we're talking about. And they start doing some blood analysis, which is not easy to do there, and they identify these people as what's called these anti-DNA antibodies. So we are creating these antibodies that basically attack your immune system there. And it creates a cascade that leads to blood clotting and cell death in certain cases there. So they believe that there's a very high level of autoantibodies, especially if you were in the intensive care and on the ventilators there. And so that's just been studied. It's a small study, only 115 people there. But as we're trying to understand why some people have this severe problem and some people don't. Another thing came out is this microclots. Remember, you basically have a clotting problem during the acute part of the disease there. And they are discovering basically an inflammatory molecules that may explain why some people have a problem recovering. And these molecules there are resistance is called to the trypsin. And as a result of that, you're having a problem in breaking up the blood clots. So therefore, as the body is making blood clots when you're having the infections there, those people don't have the natural response of the body to break the blood clots, and therefore they may lead to TIAs or mini strokes and other problems where the blood clots damage part of the body. And remember, blood clots are everywhere. So it could be any part of the body there, from the kidneys to the skin and all of that. There's a concern, and this is a significant concern, that long COVID, if untreated and people don't get to rehab very quickly within the first 6 months after the infection, may turn into what's called chronic fatigue. And the reason why we don't like chronic fatigue is these patients end up in a situation for years, if not decades. And half those people there, like no, in the case of long COVID, in the case of chronic fatigue, 70% cannot work and 25% are homebound. I mean, they're literally in beds. So we don't really want this to happen to people there. Again, that same definition of chronic fatigue is as post-exertional malaise, which is you're worsening your symptoms with mild exertion. You have this crash and relapse. I'm talking crash, like, really exhaustion there for several days there. So, right now, as far as chronic fatigue, there's around 1 to 2.5 million Americans. And again, it's something that we cannot diagnose with the blood test or imaging there. This is something that it is perceived to be also post-viral, that people had a damage due to virus infection there. So what's the similarity there? And I'm not going to spend too much time, but there's pretty much this cascade of oxidative stress that creates chronic inflammation there. And what we know is that it's a two-way circle there. So you have this initial abnormality, which is the virus, that creates that cascade, and it basically self-reinforces itself, and the cycle doesn't stop. Okay. And so if we compare long COVID to ME, so they did two groups of people, 278 long COVID versus 502 chronic fatigue. And you can see they have a lot of similar symptoms, the sleep problems, the cognitive functions, the fatigue, the post-exertional malaise, which is called PME. Now they have some differences there. And so we're hoping that if we can get people to rehab very quickly after they have the infection there, within 6 months of the infection there, you could avoid these patients to have long-term problems for years. Okay, so again, we're learning as we go. Let's look at some of the data there. What happens to the heart? 3 things happen to the heart. There's an Italian study that shows that the virus attacks the heart 3 different ways. We know it's cytotoxic to the heart cells, and I'll show you some pictures of that. We know it creates what's called hypoxemia, which is a drop in oxygen that damages the cells of the heart. And we know that we have the cytokine inflammation that also attack the heart. So the poor heart is getting a triple attacks when you have the infection there. And it has an impact, not just in the heart, but pretty much in the whole cardiovasculature, which is the capillary beds, which is some people have this COVID toes, they turn kind of blue color there, all the way to all the arteries and veins all throughout the body there. So I won't go into all the detail there, but we know that the heart is very dependent to what's called the ACE2 receptors, and we know where the virus goes in the ACE2 receptors there. And it creates an edema, which is an enlargement of the heart, which is typical of congestive heart failures, and acute myocardial injuries. So I know of 2 people who basically had mild symptoms, and 3 months later, they had massive heart attacks. And they end up having lost 75% of their heart function because they were not aware that the virus was basically slowly eating away at the heart function there, which is dropping the ejection fraction, which is the amount of blood you can pulsate out, and damage to the heart, which is long-term. So this is to give you an idea there, if they do the biopsy of somebody who died, you can really see that the cells are inside the heart. You can see like all these blue things, is the particles that have been damaged there from the virus. This is an interesting test that was done. So the heart is a big muscle that pumps. And if you look at these muscles here, this is this fiber that contracts. That's really the key thing there. Somehow the virus, through the ACE2 receptors, goes into these cardiomyocytes and damage them. They damage them and they literally strike them to pieces. And that has been shown when they did the pathology of people after they did an autopsy. And you can really see that the heart tissue contractile force, which is the ability to contract, is lowered drastically. And this is a picture there where you can see these long fibers here before they got exposed to the virus. And then after that, there's nothing left. You don't see any fiber here. It's like Cuisinart. It was shredded to pieces. Not only that, but the missing DNA, the nuclei, which is what makes, keeps them alive, basically disappeared. It's irreversible. And this was confirmed by heart autopsy, by doing MRI of patients after 2 months, and they noticed 78% of people had some type of problem with their heart, and it basically it's an irreversible damage of the heart. So that it is unfortunately affecting the heart. In addition to the damage to the muscles of the heart, the electrical, remember the way the heart contracts is that you get an electrical wave that basically tell the muscles to contract themselves, and if that doesn't work, you have what's called arrhythmias. And 20% of these people had that abnormal heart rhythm there. And so that's an issue there, because some people may recover over time, but some people may need an implantable defibrillator or pacemakers, depending what the problem is. So in Wuhan, they did some cardiac injury and for patients who were in the ICU, and they basically did the extensive analysis, and they find out between 7 to 22% of the patients had some type of injuries that could be measured by interleukin-6, which is a biomarker in your blood that shows that you had a mini heart attack. Let's look at the lungs. In the lungs, picture is 1,000 words. This is the picture of a normal lung. This is a smoker lung, so you can see it's more opaque, and this is a lung of somebody who had COVID, i.e. you've done damage to the little alveoli, and the alveoli is where you have the transition of oxygen and CO2 going from the lungs into the vasculature and back. And to give you an idea, this is a CT, which is much more defined than an X-ray, of a patient in British Columbia there, and you can really see a very normal CT there, very nice and transparent. You can see all the damage, all the fibrosis inside the lungs of somebody who had been exposed to COVID in a severe case. You have in the lungs this little cilia, as we call it, and that's what basically helped the transfer. And you can see how COVID is really all over the places there, and so this is it's really like an invasion of the ability of the lungs to transfer oxygen there. And this has just been validated recently there by data that shows that people who have long COVID have lower exercise oxygen capacity. Another way of saying this in plain English is that as you exercise, your ability of bringing oxygen into your tissue for exercise is decreased. You're not able to transfer. And that is why it believed is that exercise intolerance, this exercise malaise that I mentioned, that because when they exercise, they're not able to bring oxygen to your muscles and your tissue like a normal person does. And they believe that is really, if we can really continue to measure that, is one of the way to monitor those patients. That this is a brand new data just came out like 1 or 2 months ago there. And so that's a big deal, because that means that explains a lot of those symptoms to these patients there. A study done on SARS. SARS in 2003 was basically a disease that was a cousin of COVID-19 that was just in the lungs. It wasn't on the heart. And what they showed on those patients, there's 2 years later, those people who had damage there was no improvement 2 years later. So those damage are permanent there. It was a small data set. It was 55 patients there. And they did lung function assessment from 3 to 24 months afterwards. But you can see that glass opacity I just showed you before, which is kind of the key feature that you have damage inside your lungs called fibrosis there, did not really improve after you have those. So let's look at the brain. A brain is really the leading determinant of long COVID. It's what we call the COVID fog. And it's like, think about like a massive concussion, so traumatic brain injury of the brain. It's headache, dizziness, you can't think straight, you have a memory recall problem there, you have anxiety there. It's perceived that it could be due to blood clots that creates mini strokes, and that could be one of the rings. And there's another belief, there's what's called demyelination of the nerve. So this is the myelin that goes around the nerve. And that is really a sign of an autoimmune disorder, which may have been a trigger by the virus there. And that's a problem there, because that could go all the way to not only the brain, but also weaken the arms and the leg muscles, because those nerve is what activates your muscles in the body there. And it's really across all ages and severity. This just came out literally today or yesterday, and they did an analysis at Mount Sinai in New York, and they look at 740 patients who were in the hospital. So we have a more severe group there, and then they look what happened to them several months later there, and you can see, this is really surprising, is that the cognitive problems there is as low as 10% to as high as 39%. Now, clearly somebody who was hospitalized is a higher risk of memory recall. Remember, I showed you earlier there that if you're over the age of 65 in the hospital there, you have a significantly higher risk of having these memory problems there. But you can see that it is really across the board. All patients there on a very high percentage rate had this problem months later there. So it's being validated over and over again So more than a quarter of patients, the CDC report, have developed neurological symptoms after the acute. So it's not these people had symptoms before. It's really people who have basically were totally normal before they got infected by COVID. Another data came out using MRIs, and they were able to show that up to 40% of survivors had neurological effects there. And that could be fatigue, myalgia, which is pain, headaches, dysautonomia, cognitive impairments there. And they were able to show, and I'll show you some of the pictures there, that you can really see the white matters have injuries. You have damage to your brain cells. And so I'm going to show you some of the, it's called a large infraction there, which is a damage to the brain tissue as high as 44%. And as the pics are coming up. And another data from Lancet on 236,000 patients, so these are huge data sets. Now we finally have some big numbers, show that 34% have some type of what they call brain disease. And I put this because it's not really a disease. It's really something that, they have symptoms that they didn't have before. Again, mood disorders, anxieties, some people have the high ischemic stroke that they could see imaging there. And Northwestern is again showing some data there that a lot of those patients didn't have a positive confirmed test because at the time they had mild symptoms. They really didn't get a PCR. And so a lot of them are female. Also the data seems to be showing that it may be as, more average than 50%, but some of the studies are as high as 70%. So let's look at the astrocyte. And so if you look at an MRI here, and you can see in orange there, this is the area of the brain that they were able to see the damage from the virus infecting the body there. And as a result of that, that part of the frontal cortex there is what drives your cognitive impairments there. That's your memory recall. That's some of these, what's called effective executive functions. And then when they did autopsies there, they saw that 19% of people who died had some signs in the autopsy that they could see of brain damage there. So clearly the virus is affecting what's called the astrocytes, which is in the stem cell. So it is going across the blood-brain barrier there. Again, more imagings there. They can really see on the MRI that this is creating what's called apoptosis. Apoptosis is a fancy word for saying the neurons kill themselves, so they die in a certain part of the brain, which unfortunately is kind of linked to some of this function there. And then they've done all this testing there that how it's affecting the oxygen consumption there, which is how healthy those cells are. They've done some what's called cognitive testing there. This is a immediate recall, delayed recall. You may have done some of those when they ask you what they told you 5 minutes before, see if you could recall them. The trail is the ability of doing things. And this is interesting there. In blue is asymptomatic there. And you can see that even mild patients, they have these problems there. It's not the people who have severe, which is the purple. Clearly, some tests are worse than others there. But again, I want to emphasize that the brain fog is affecting everybody, including asymptomatic. So Wuhan, again, has the best data, and they can show that going over time that they are, in their case, they report 36% there, much higher for people on ventilators, but we know ventilators create that problem there, so we should probably put this on the side there. But they show, more importantly, lung fibrosis as high as 20 to 30%, a drop of lung function there. So there is a damage to the lungs. So I hope this was helpful there. If you appreciate this content, please subscribe to this network, post to your network. We have to do the network effect. YouTube has changed the algorithm. And so I really appreciate your efforts there. If you haven't seen the video I posted yesterday, it's an update on October 22. A lot of good news about vaccine effectiveness and the boosters. You don't want to miss that. So please stay healthy.